Good afternoon, everyone. Today is Thursday, March 7, and this is the Board of Health monthly meeting. And we are passing on to Dr. Andrade, who will chair this meeting to call it to order. Let me also remind you that this is a public meeting and therefore it will be recorded. Dr. Andrade, pass on to you.
Thank you, Dr. Massour. Welcome, everyone. We are here on March 7th for our monthly meeting. And we would want to first start with
The minutes?
The meeting minutes from February 1st. Any edits, changes, or questions about it?
Don't see any here.
If none, can I have a motion to accept those minutes?
I make a motion that we accept the minutes as posted.
I second it. They are
Aye.
accepted.
Okay. Thank you. Dr. Andrew, the next item on the agenda is with respect to gas depot. We called on that tobacco retailer last month. There was a little bit of ambiguity on the violation, and you have asked that I contact the law department to advise, and the advice was that the language written within the document says that the violation shall be, and so therefore the attorney representing the solicitor of the city says that in the legal jargon or vocabulary, shall be is basically the standard, and so there is no flexibility within that.
So the standard is 14 days, 2 weeks for the suspension.
Correct.
Do you have any questions?
I have no questions. It was just, I think the last meeting, there was a minimum and a maximum.
Right,
That's why I went for the minimum. But if 14, I mean, that's just what it is, and we have no choice on the matter.
Mr. Mattel, do you have any questions?
No, if it is the case, yeah.
Mr. Duchette, do you have any comments or considerations?
I do not, sir. That, as the doctor said, the city regulation stipulates that the period of suspension shall be not less than 14 days.
Yeah. So we just amend our last minute meeting and decision, and that is clear now that it is 14 days. That's the standard, and that's what we hold to. So we had this long discussion last time. We've gone through the rationale and everything like that. So unless you have any other questions, we can move on to other business, Mr. Patel.
So after this meeting, I'm going to get the official document for 14 days.
Correct.
Okay.
And then the hope is that you move through any refinements to your training, education, and quality assurance to be sure we don't have this conversation again.
Yeah, that has been done throughout the February month after the first meeting there.
Congratulations.
Yeah, thank you.
Well, thank you for your patience, and best wishes to you.
Thank you.
Best wishes here too.
Okay.
So we move on to item 4.
Yes, item 4 is still no word from the other side of the hill or from the mayor's office, and I have not heard anything back from Mr. May also. So which means that at this point, the Board of Health has no further statement to provide the directors on
Right.
that matter.
Item 5 is the last statistics on COVID cases.
Yes, thank you very much. As stated on the agenda, I have provided comparative analysis or just a comparison of previous months from December, end of December, which is 2023, and then beginning of 2024, second month, and then up to the day that the meeting, the agenda was posted, where we had 3 new cases, and active cases at that point was 29 for the 7 days, last 7 days, leading on to the meeting being posted, or the agenda being posted. And then we had 35,311 cumulative cases total, and then a total of 544 deaths. One was recorded in February. As of this morning, we have just 1 new case with 26 active cases, which means that up to this morning, there were, from the last 7 days, there were 26 new cases reported, and then the cumulative is 35,318 and 544 deaths. That's the total death. We continue to monitor cases from water sample, the wastewater, but it is going down significantly as well. I think the number of copies of the virus is well below what we've ever seen before. So that's a good sign. DPH has also mentioned that they're going to modify the language. We don't know yet. It looks a little bit ambiguous, but we will see how it will play out when DPH puts it out. And they're going to modify the language on the length of days for isolation. So since it's not public yet, I just give you the heads up, because apparently they propose that they will, if people have no symptoms, or they've been without any symptoms and no fever, they can show up for work. So it's
The
not
new
out.
CDC guidelines.
Yeah.
Yeah. Yeah. Times they are changing.
Yes. And also with respect to vaccination, we continue to do vaccination, and we are at the shores every Tuesday from 1 to 4 p.m. Also, with respect to events, we had a great event yesterday, and I didn't take time to ask everyone to introduce or to recognize everyone today, but we did have on that meeting Doucette, Inspector Doucette, representing Inspectional Services, and then Dr. Andred as the chair of the Board of Health of Directors right now, Mr. Fisk, myself, the Executive Health Officer. We did have Sarah McColgan and Mr. Patel, and we also have with us Sarah Seaver, who is an intern. I mentioned her name last. Well, I want to recognize Mr. Simmons also from the from BCA, but I want to get back to Sarah, to Rachel, because as an intern from Bridgewater State University, she has taken a project. And yesterday we had the initial project, and that is a community event. We had it at the we held it at the Campelos building. They saw 39 people. We did blood pressure for them, vital signs, and blood sugar test. And I'll let her say a little bit more. Rachel, would you jump in and give a little bit more?
Of course, yes. Hi everyone. So just a little bit about my project in general. So as an intern here at the Board of Health, I have to kind of choose a project or a kind of goal as a part of my hours. And so from the start, I kind of just wanted to find a way to help the community in a way. And I know that at times in the community, there's people that don't have health insurance or people that don't have access to care because they're new arrivals, all that kind of stuff. So I kind of spoke to Dr. Montezier and public health nurses, and we kind of, and when I first started in January, to find a way to kind of get the word out. So I made up flyers and questionnaires to go along with it, just to find correlations with people that have high blood pressure or hyperglycemia, all that kind of stuff, just to see if they have access to healthcare, access to insurance, all that kind of stuff, and just in general being able to have access to that kind of stuff, knowing that information, and just getting resources out there. So.
Rachel, thank you for your work. I really appreciate that. Can you give us a little background on what is the program that you are at Bridgewater State and where are you in the program?
Yeah. So I'm a public health major. I'm completing my bachelor's degree right now. And so as for public health majors, you have to complete 270 hours within public health field. So I feel very fortunate to be part of the team at the Board of Health in Brockton. I've definitely learned a lot. And just in general, each student, you kind of just have to find the project or the job on your own. So I feel very fortunate to be able to be here because a lot of students, like a lot of my friends, weren't even able to find one. So I feel very fortunate that I'm able to make an impact on the community. Especially from Brockton.
When did Bridgewater get a public health bachelor's program?
I think around maybe it's kind of recent. I think probably less than 10 years ago.
Ah,
I'm a senior now, so it has to have been at least 4 years.
Right.
But I'm pretty sure it probably started when I was in high school.
Interesting.
So yeah, it's a great program. I've really learned a lot and I'm excited.
I'm sitting here at Boston University School of Public Health. I'm the Associate Dean of Practice here. And I'm alum of Bridgewater State from their athletic training program
Oh, no way.
a while back. Yes, so small
Thank you
world.
so much. Yes, it truly is. Yes.
Thank you for your service. And if there's anything that I could do to support you, please don't hesitate to reach out.
Thank you so much, Dr. Andrade.
We wish you the very best.
Thank you so much.
Yes, and so the nurses, all three nurses, two of the community health workers were there yesterday, and our epidemiologist also, Dr. Sebastian, paid a visit there. He didn't stay too long, but the nurses and the community health workers were there. So the event was conducted in multiple languages. I believe English, Spanish, Haitian Creole, French, Cape Verdean, Portuguese.
Yes. Yeah. So Portuguese, Cape Verdean Creole, Haitian Creole, Spanish, English.
And you speak all of those?
No, I only speak English. I wish I did. I know. I used to work at Brockton Hospital before the fire, and I was trying to learn Portuguese, but school and everything, it just got away from me. But hopefully someday.
George, you speak Cape Creole, correct?
Some of it, yeah. I lived in Cape Verde for 5 years. I had a funeral home there, so yeah. But the longer you're away from it, the more you lose it too a little bit. But
Yeah, I'm
Yeah.
Cape Verdean, and all I know is the swears that my grandmother used to yell at me.
well, then you know everything.
All right, back to business, y'all.
Yes, and so in closing, over the event, it's a recurrent event. It will be at a different location every Wednesday. So next Wednesday it will be at the Caffrey Tower.
Great.
Okay.
Okay, and then let's see. As I already mentioned, that we continue to vaccinate, to provide vaccination, to make it available. And then also we have no vacancy at this point because we've filled the last two vacancies that we had with an epidemiologist and community health worker. We have one health worker who is out on maternity leave, who will return sometime the end of April. Promotion on public health, we continue to advocate on behalf of the community as I am going to the seat at the 14 largest municipalities to represent Brockton. There are many issues that we raise, we discuss, and one of them is the opioid crisis.
Mhm.
And the municipalities are looking into how they can make resources available to the municipalities in such a way as to maybe open treatment site. And so this is the discussion. I do know that some municipalities have resistance on that, some pushback from the communities, but it is the discussion that the 14 largest municipalities are having. Commissioner Goldstein visited New York few months ago, and I think some of the members of DPH also visited the program in Canada so that they can learn a little bit more on that and how to replicate it in the US. We do meet with the Commissioner Goldstein every so often when we have meeting, our meeting. So we will give you more information as it becomes available.
Thank you. My understanding is legislators have made some visits to centers in New York as well.
Yes, that's also correct. And I have met with Commissioner Doyle. We had a meeting, Mental Health Commissioner Doyle, and she is very encouraging in looking for opportunities or ways to support emotional health in Brockton. And so we continue to work together to see how to best serve the community. Brockton Neighborhood Health Center does play a role in that with respect to behavioral health. And so we don't have anything concrete to present right now, but in the coming weeks or months, perhaps we'll have something, how to put it together to maybe address the mental health of Brockton. With respect to the two hospitals that have been impacted by one by fire and one by economic difficulties. The last I heard from Brockton Signature Hospital is that they're pushing to open sometime probably in early June. And with respect to Steward healthcare system, they did meet with the mayor, and I attended one of the meetings. They said that they will not close. Now, I don't know, I cannot say beyond that. They did say that they will not close. They're trying to find someone to take over. And I think that the power that be also, the governor and her secretaries are looking to see how to make things more transparent with the system in the state, including Brockton as well for Good Samaritan. So I'll update you as more information becomes available on that.
Thank you.
You're welcome. Thank you. So TB, we do continue to serve. We still have 2 individuals that we subsidize housing for through the grant given to us by DPH. They do that. The cases keep the nurses busy because they do DOT every day. Some of the cases, they follow 3 days a week. And then the community health workers follow the other 2 days. So it's a very strict regimen to make sure that they complete their TB treatment. We do have about the same amount of cases. We did add 1, but with those that have completed treatment and have moved on. So right now we are at 11 cases total. And that's about what I have to present to the board.
Is there anything that you could say about, there was a consideration that we have someone that is interested in joining the board?
Oh, yes, thank you so much. Actually, I reached out to the mayor and yes, so he asked that we send the CV to him. And he will act on it. So I must say also there is another person who has been designated, who has been identified as another physician. because with respect to keeping up with vaccinations and ordering vaccines, so there has to be a physician among us over the board. So aside from the person that you recommended, I don't know if that there was a CV. I did not see one yet. So
They did, I thought I did share that,
oh,
but
okay.
that person is not a physician.
Yes, yes. So that would make two cases. I mean, two candidates. So I'll reach out to see what I know you said something. So I'll look into it again, and I'll let you know, because I don't know if they're going to put two persons, since it was at three, and I bet that, you know, in order to keep up with the ordinances, they probably will just nominate one person.
Well, remember, my plan was originally to step off of the board. I'm here because Dr. Brophy decided to retire from the board. And we should have three, right?
Okay.
So if they're able to find a physician that's that meets the particular need around access and ordering, and then have this other person, then that would allow me to step off. Again, I'm happy to serve as long as necessary, but at the same time, I worry about my ability to be here consistently because of the responsibilities that I have here.
Okay, okay. Well, I'll brief the mayor on that, and then I'll follow suit with what information that you give me, and then I'll keep you abreast.
Okay.
Sounds good.
And again, I'm putting that out there as an overall. That may change, but again, I also want to give others the opportunity.
All right, thank you. And that is all I have to present today.
Do we have a motion to adjourn?
Got a motion to adjourn
Seconded.
till next, yeah.
And the next meeting date is April 4th.
So April 4th, getting ready for my birthday.
There you go.
I'll register where my presents can be found.
Okay.
Happy evening, everyone. Take good care.